I want to talk about the SI joint. So we want to look at some assessment of whether the SI joint is a problem in terms of lumbar spine, because problems with the SI can be a contributor to or can mimic or can cause similar symptoms to other lumbar problems, whether that's instability, whether it's referred pain because of stiffness. So we want to identify an SI joint component. The problem has always been is how do we differentiate between lumbar problems and SI joint problems. The specific problem is that the SI joint right here with the PSIS and the L5S1 facet are very, very close together and very difficult to differentiate between the two. So over the years, there's been a number of ways that we've tried to address this. I want to call your attention to the studies by Mark Laslett and his group that are referenced in your manual. And what they did is they tried to find out a way that they can reliably block the SI joint to determine the prevalence of symptoms. In the spine, doing a spinal block is the definitive way and the gold standard for identifying a spinal level. If I have a problem joint that I suspect is involved or pathological, I can inject it. If the pain goes away, I know I've localized it to that problem. The problem has been the SI joint is a difficult joint to block. It's a large joint and it's easy to infiltrate adjacent tissues. So they came up with a way to reliably inject the joint to anesthetize it to see if the SI joint is contributing to the patient's complaints of low back pain. When they did that, along their original study and then a validation study, they came up with the prevalence of SI joint as the primary source of pain is about 15% of the time. So in your patients with low back pain, the SI joint is going to be the main source of symptoms about 15% of the time. The other 85% is probably going to be lumbar or pelvic in origin, but primarily lumbar. So their recommendation is to do your exam the way you'd normally do it. If you find any symptom provocation, perhaps with PAs or whatever, then you have a lumbar problem, treat it as a lumbar problem. Don't worry about the SI joint. If your lumbar exam is unremarkable for reproduction of symptoms, then what you want to do is run through the SI joint test.